The Montefiore International Program is a program that reaches children and adults who have very complicated illnesses from all over the world. In 2014, we evaluated 20 patients, and most of the patients came from Saudi Arabia and from Kuwait, and it's expanded now to 20 countries. Montefiore is a destination hospital. It's a hospital that cares for patients and families from all over the world. So oftentimes when we initially meet with the families, one of their single biggest concerns is, how will you communicate with me because I do not speak the language that you speak. One of the examples that I like to highlight is the example of Dr. Shalom Kelnicki and the importance that he plays in the Cancer Center of Excellence and the care for patients from the Middle East who have a cancer diagnosis. He has brought in a resident into the international program who speaks Arabic. And what a pleasure it's been to have a resident from radiation oncology part of our overall program. Shalom Kelnicki is one of the reasons why the embassies enjoy and trust sending patients to Montefiore. Montefiore's strengths begin in the centers of excellence, and there are 5 centers of excellence that we have developed over the years as part of our strategic plan. Children's services, cancer services, cardiac services, transplantation, and neurosciences. So when we speak with the embassies about our strengths and our expertise in those centers of excellence, and most importantly, the outcomes that we have in each of these centers of excellence, they're obviously very attracted to those particular centers and certainly to the outcomes that we've achieved with those patients. The embassies have asked us to respond within 48 hours of a request. And so we have partnered with our clinical leaders in pediatrics with Judy Ashner, in radiation oncology with Shalom Kelnicki, in transplantation with Milan Kinkabwala, and worked very closely with them to ensure that every embassy that makes a request of Montefiore is responded to within 48 hours. One of the programs that we're most proud of and that we've talked with our colleagues in the embassy about quite a bit is the International Program for Craniofacial Patients. And I'm very pleased with the progress that we've seen there. And of course, we have world-leading expertise with Dr. Jim Goodrich. Recently, Dr. Goodrich has been in Saudi Arabia working on conjoined twins at the behest of the King of Saudi Arabia. And we anticipate wonderful outcomes there as well. When a patient travels 7,000 miles to the Bronx for healthcare, one of our responsibilities is to try to make them feel at home. We've been able to partner with the Montefiore Housing Office to ensure clean, affordable, safe, nice housing that is literally across the street from the hospital.
Montefiore is now recognized as a place where patients with the most complicated problems can turn for treatment. Part of what Montefiore believes in, obviously, is taking care of our neighborhood, and the idea that our neighborhood extends beyond the Bronx, beyond New York, and really now is global in reach has become a reality.
We want our Middle Eastern families to feel like our own families would feel coming to Montefiore. And one example I'd like to highlight is a child that came from Kuwait with their family. And the family felt that we did such an extraordinary job, but not just the quality of the medical care. They were also so pleased that we took care of the needs of the family that they decided to hold a celebration that was held for all of the caregivers responsible for the care of this beautiful child.
We summarized all the care that we give for the international patients in 2 words, which is love and teamwork. We love the families that come here, and we give them the best that we can as a team together.
We're very excited about the new space that's being allocated to the international program. And one of the benefits that we've extended to the embassy is we've given them space within the department now to position embassy officials within that space so that they can help manage the respective patient from their country that is here in the hospital. It gives me great personal satisfaction, and it certainly gives great satisfaction to all of the 20,000 or so associates that work at Montefiore when we see this beautiful child leaving our hospital, going back to their country, and then telling the Montefiore story that this is the institution that saved my child's life.